You've probably heard 1,000 quick fixes for diabetes: cut carbs, drink this, avoid that. But there's a quieter, smarter lane that more people are rediscovering. Targeted herbs with real mechanisms that help blunt glucose spikes, improve insulin sensitivity, and calm the inflammation that makes blood sugar harder to control. Today, we're going deep on 4 of the best-researched options: Aloe Vera, Gymnema Sylvestre, Salacia Reticulata, and Berberine. How to actually use them. The forms that work, evidence-backed ranges, timing, pairings, and the exact safety notes people miss. This is education, not medical advice. If you're on insulin or glucose-lowering meds, have kidney or liver disease, or are pregnant breastfeeding, you must clear changes with your clinician. These herbs can potentiate medications. Keep your meter or CGM handy. Your data is the final word. 1. Aloe Vera, Aloe barbadensis Miller. Think of aloe as a multi-tool for glucose. It can nudge fasting numbers down, flatten those digestate bumps, and reduce the background inflammation that makes insulin sluggish. Why? It helps plain English mechanisms. Aloe's polysaccharides and flavonoids appear to activate AMPK, your metabolic switch. Help move GLUT4 to cell surfaces so glucose gets out of your blood and into your muscles. And gently inhibit carbohydrate digesting enzymes, so a meal releases sugar more slowly. It also behaves like a prebiotic, feeding gut microbes that improve glucose handling. How to use: start low. Test, build, juice, decolorized, aloe-free. Begin with 2 ounces 60 milliliters on an empty stomach for 1 to 2 weeks. If you tolerate it, increase. 4 to 6 ounces, 120 to 175 milliliters daily. Extract capsules standardized. Start 500 milligrams daily. If well tolerated, move to 500 to 1,000 milligrams per day split or pre-meal. Closing parenthesis, timing that matters. Fasting glucose focus. Morning on an empty stomach. Post-meal flattening. 15 minutes before meals capsules. To slow carb breakdown. Smart stacks you can try. After you've tested solo, aloe plus cinnamon insulin sensitivity bump. Aloe plus berberine fasting plus gut synergy. Closing parenthesis. Aloe plus ginger post-meal. Curve plus inflammation. Aloe plus magnesium. Insulin signaling plus nerve support. Quality filter. Look for organic, cold-processed, decolorized aloe-free liquids. No added sugars or artificial preservatives for capsules. Choose brands that disclose standardization and are third-party tested. Safety you can't skip. Unfiltered latex aloe is a laxative and tough on kidneys. Even good aloe can loosen stools at first. Start low. Aloe can enhance meds like metformin, insulin. Watch for hypos. If you have liver disease, pregnancy, or active kidney issues, skip unless your clinician approves. Use for 12 weeks, then take a 1 to 2 week break before continuing. Meter moment. Take readings pre-dose, 1 hour and 2 hours after breakfast. If aloe drops the peak and speeds the return toward baseline without GI upset, you're in the zone. 2. Gymnema Sylvestre Sugar Destroyer. If cravings are your kryptonite, Gymnema is the herb that can quickly make sweet things taste not so sweet. That's not just a parlor trick. It buys you space to choose better and reduces intestinal sugar uptake at the same time. Why it helps. Gymnemic acids temporarily block sweet taste receptors, dulling desserts reward. In the gut, they reduce glucose absorption. In the pancreas and muscle, they support insulin release and glut for activities, so more glucose gets used. Not parked in your bloodstream. How to use: phase it. Craving control, 100-200 mg. Standardized extract right before a situation where sweets tempt. The effect on taste can last 1 to 2 hours. Daily glucose support, 400 to 600 milligrams per day. Divided before meals. Longer horizon A1C, 600 to 800 milligrams day for 12 weeks. Then a 1 to 2 week break. What standardized should mean. Aim for 25% gymnemic acids. Avoid mystery blends and sugar-filled gummies. Yes, the irony, stacks that play well. Gymnema plus berberine fasting plus post-meal. Gymnema plus cinnamon insulin action. Gymnema plus alpha-lipoic acid ALA. Nerve protection. Gymnema plus chromium. Insulin receptor sensitivity. Safety you must respect because it enhances insulin's effect. It can push you low if you're on meds. Start small, track closely, and loop in your clinician for dose adjustments. Possible mild GI symptoms early on. Skip during pregnancy. Breastfeeding. If you also have low blood pressure, monitor. Gymnema can nudge BP downward. Real-world tip. Try the dessert test. Eat a few bites of your usual sweet on a day without Gymnema and log your 60-minute glucose. On another day, repeat with Gymnema predose. The taste change plus a gentler curve is a compelling one too. 3. Salacia Reticulata, Ayurvedic carb break. Salacia is the quiet specialist for post-meal spikes. Your fasting looks okay, but breakfasts and dinners make your graph look like mountains. This is your targeted brake pedal. Why it helps: its active salicylic cotylenol inhibit alpha-glucosidase and alpha-malase, delaying starch breakdown by a meaningful margin. Less rapid carb digestion equals smaller, slower glucose waves. There's also a gut microbiome angle. More beneficial strains, lower inflammatory tone, better insulin signaling. How to use: keep it with meals. Spike control. 250 to 500 milligrams, 15 minutes before carb-containing meals. Daily. Control. 1,000 milligrams day. Split before 2 meals, a 1C. Focus. 1,000 to 1,500 milligrams per day for 3 to 6 months. Then take a short break. Label literacy. Look for extracts disclosing 10 to 15% salicylic cotylenol equivalents. Third-party testing. No artificial fillers. Stacks that shine. Salacia plus cinnamon adds insulin support to enzyme break. Salacia plus berberine fasting plus post-meal synergy. Salacia plus fenugreek fiber plus enzyme inhibition. Salacia plus a quality probiotic. Microbiome leverage. Safety corner, because it slows carb digestion. Pairing with meds that also blunt post-meal glucose can overshoot. Monitor for hypos, lightheadedness, or unusual fatigue. Some people get mild gas, early usually resolves. As the gut adapts. Avoid during pregnancy, breastfeeding, unless supervised, at-home experiment. Pick your highest spike meal, often rice, bread, or pasta. Run it without Salacia once and record 60 and 120-minute values. Next time, repeat the same meal, add Salacia. 15 minutes before, can compare curves. For berberine, the metabolic multitasker berberine is the heavyweight. It acts on a MAMPK, the gut microbiome, intestinal carb enzymes, and inflammatory pathways. Many people see improvements in fasting, post-meal spikes, lipids, and even waistline when they do it correctly and give it time. Why it helps? Activates MPK cells burn fuel better and become more insulin sensitive. Inhibits alpha-glucosidase. Smaller post-meal bumps shapes the microbiome. More beneficial bacteria. Linked to better glucose handling. Anti-inflammatory antioxidant. Lowers the friction that drives insulin resistance. How to use: respect the half-life. Standard approach: 500 milligrams. 2 to 3 times daily with meals total 900 to 1,500 milligrams. Day closing parenthesis ease dash in plan. Start 500 milligrams once. Daily for 3 to 5 days gives add a second dose. Gives consider a third if needed. Cycle. 12 weeks on, 1 to 2 weeks off, or is advised to maintain responsiveness. What? To buy, look for Berberine HCl or sulfate with 97% purity. Third-party tested. Some formulas add piperine or milk thistle to improve absorption. Fine if tolerated. Stacks that make sense. Berberine Plus, Salacia meals plus fasting. Berberine Plus cinnamon post-meal control. Berberine Plus, chromium insulin receptor sensitivity. Berberine Plus Aloe, nerve support. Pair with high-fiber meals to nudge microbiome. Shift safety realities. Berberine can lower glucose a lot. Coordinate with your clinician if you're on insulin, sulfonylureas. It also interacts with liver enzymes. If you take multiple meds or have liver disease, get the green light first. Mild GI upset early on is common. Starting low helps. Avoid during pregnancy/breastfeeding. Proof to yourself. Watch your fasting. Trendline week to week, not just post-meal peaks. Many see a gentle stair-step down across for 8 weeks, especially when walking after meals and prioritizing protein at breakfast. How to build a personal herb plan. Simple, safe, effective week. 1-2 single variable testing. Choose one herb whose target matches your biggest issue. Dawn spikes. Aloe, empty stomach. Dessert cravings. Gymnema pre-temptation. Taste blunting. Meal peaks. Salacia. Opening parenthesis pre-dash. Meal closing parenthesis dot across dash the board high. Berberine with meals. Divided. Track fasting. 60 min. And 120 min post-meal values for the meals you struggle with most. Note, GI tolerance. Week 3 to 4 layer, don't pile if you still have a glaring gap. Add a second herb that solves a different problem, for example, Berberine baseline plus Salacia for pasta nights. Keep everything else the same so you can attribute changes. Every 12 weeks, take a 1 to 2 week break from each herb or rotate to maintain sensitivity. Reevaluate labs A1C, lipids with your clinician if possible. Daily anchors that make herbs work harder. Breakfast equals protein plus fiber plus healthy fat. Walk 10 to 20 minutes after the largest carb meal. Hydrate. Consider electrolytes if you're peeing. A lot from high glucose closing parenthesis sleep. One bad night can raise fasting glucose the next day. Red flags. And when 2 pause recurrent hypoglycemia, shakiness, sweating, confusion gives reduced doses. Contact your clinician. New worsening GI distress that doesn't settle after a week of low dosing, kidney or liver pain symptoms. Yellowing of eyes, skin, dark urine, give stop and seek medical evaluation. Pregnancy/breastfeeding. Hold unless specifically cleared. What a win looks like so you know it's working. Fasting glucose inches down over 2 to 8 weeks. Post-meal rise trims by approximately 20 to 40 milligrams DL. V's your baseline for the same meal. Smoother CGM line with fewer sharp peaks, less carb hunger. After Gymnema, smaller portions feel sufficient. Better energy, fewer afternoon slumps. Conclusion: Aloe shot in a small glass. A capsule sorter labeled Gymnema lunch, dinner. A tiny Salacia bottle next to a bowl of rice. Berberine split across meals, then a CGM graph smoothing out across days. If this helped, tell me which herb you're starting with and what you're pairing it with. I'll pin a simple 4-week tracker you can screenshot to log doses and glucose curves. And if you want a full stacking guide with meals and movement, comment guide and I'll prioritize that next.